Why does an IVF cycle fail, and what is a doctor's perspective towards the failure of your IVF cycle? Namaskar. I am Dr. Leena Yadav and I am a fertility specialist. When an IVF cycle fails, who is to be blamed? The doctor or the patient? IVF is a complex medical process and we need to understand that. And failure can hit anyone. As there can be any factor, there are several, thousands of reasons. And I am here to discuss the doctor's perspective with you today. There can be a problem with the stimulation protocol. There can be a problem with the embryo transfer window, what we call as implantation window. There can be a problem with the lab quality, the filtration systems which are used in the lab. There can be an issue with the expertise of your embryologist. There can be an issue with the injections, what have been used for your treatment. Maybe the cold chain was disrupted, or maybe the injections which you needed were not the right ones. So there are thousands of reasons, and there is a planned system where we can give the corrective measures. Timing of embryo transfer is very important. You need to have the correct uterine environment when we put the embryo inside your uterus. If that window is missed, what I said that we call it as an implantation window, the embryo will not implant even if it's the best quality embryo for you. What was the quality of your embryo which was implanted? Was it a day 2 embryo? Was it a day 3 embryo? Was it a day 5 embryo? What was the grade of the embryo which was put? Embryo quality and grade is a very powerful factor to decide implantation. There are other hidden contributors: thyroid imbalances, autoimmune factors, vitamin deficiencies in you and your partner, subtle uterine issues, subtle issues with the semen quality that may not be obvious in the first IVF cycle if your first attempt has failed. So don't be disheartened. A failed cycle does not mean the end of a parenthood journey. It means the strategy needs refinement, re-evaluation, reconsideration, and a deep planning, which finally might lead to some changes from your fertility specialist. Your fertility specialist might tell you to change certain other things. So please understand, IVF is a science, and science is evolving at every attempt, at every step, and it has its own timelines. So please be patient.